Hi friends, today we're going to be reviewing a practice question similar to one you may see on your NCLEX Next Generation exam. Let's get started. This question is an ordering question. Ordering questions are one of the next generation style questions that can appear on your NCLEX, so great for us to practice here. The registered nurse is providing care to clients in the post-anesthesia care unit following various surgical procedures. Arrange the following tasks starting with the most critical in order of priority. 1. Assess and manage airway patency and respiratory status. 2. Assess and stabilize vital signs including blood pressure, heart rate, respiratory rate, and oxygen saturation. 3. Complete a focused assessment of the surgical incision site and surgical dressing. 4. Provide prescribed medications for pain relief. This is a priority and an ordering question. It's important to remember that the question is asking the nurse to complete all of the tasks, but in a specific order based on level of priority. Take a second to pause this video, work through this question, and when you're ready, press play and we will review the question together. Okay, now that you've had a chance to review, let's go through each answer choice and try to narrow them down. First, assess and manage airway patency and respiratory status. So first, let's think about the importance of a client's airway patency and respiratory status. Maintaining a client's airway is pretty essential, right? Think about those ABCs: airway, breathing, and circulation. Without a clear airway, our client's survival is at risk. This is a great test-taking tip as you work through practice questions, your next generation NCLEX exam, or even on the floor as a nurse. So this definitely takes the #1 spot for now, but let's keep reading before making any final decisions. Moving on to the second answer choice, assess and stabilize vital signs, including blood pressure, heart rate, respiratory rate, and oxygen saturation. Again, thinking back to our ABCs, since this is a prioritization question, where does stabilizing vital signs fall into that? Into all of those areas, correct. We can gauge a client's breathing based on their respiratory rate and oxygen saturation. We can also assess their circulation with the blood pressure and heart rate. So this is also a high priority option. Do you think it takes priority over assessing the airway? No. Okay, so for now, this will be our second intervention, but let's keep reading to see if it needs to be reprioritized based on other answer choices. Complete a detailed assessment of the surgical incision site and surgical dressing. Assessing the surgical site is an important task for the nurse to complete for a post-surgical client. The nurse needs to monitor for any bleeding or signs of an infection. Do you think this takes priority over assessing the airway or assessing and stabilizing vital signs? No. So for now, let's leave this as the third priority intervention, but once again, let's read that last answer choice before making our final decision. All right, last option. Provide prescribed medication for pain relief. Pain relief is an important post-surgical concern. Do we think it should take priority over airway and assessing vitals? No? Why not? Because pain relief medication can affect respiratory status and blood pressure, right? So it's important to address any airway or cardiovascular concerns prior to administering pain medication. Do you think it takes priority over assessing the surgical incision site? Yes, remember, pain is considered the fifth vital sign. Great job. Why do you think it takes priority? Because pain is a physiological concern. Think back to Maslow's hierarchy of needs. Although the nurse does want to ensure the dressing is in place properly and there are no signs of bleeding or an infection, this is the lowest priority intervention for this client. All right, so if we're going to place these answer choices in order from highest priority to lowest, the correct answer would be 1, 2, 4, 3. Assess and manage the airway, assess and stabilize vital signs, provide pain medication, and assess the surgical incision site and dressing. Great job. Thanks so much for reviewing this question with me, and I'll see you next time.